Hello, everyone, and thank you for joining the Introduction to Bovine Fetal Gender Determination with Dr. Erica Wireman. I'm Nicole Cass, CE Program Manager for the Minnesota Veterinary Medical Association, and I'm pleased to be your moderator today. If you do have any questions during the session, please type them in the Q&A area, and we will answer them as we move along. I'd like to take a moment to introduce Dr. Wireman. Dr. Eric Wireman is a 2008 honors graduate of the Ohio State College of Veterinary Medicine. Following an internship at Rood and Riddle Equine Hospital, she worked in private practice until she joined EI Medical Imaging as the staff veterinarian. She manages the education and training department at EI Medical Imaging, where she teaches current and future customers, as well as vet students, to incorporate ultrasound into their practices. I'm going to turn the session over to Dr. Wireman.
Hello, everybody. Thank you for having me today. This presentation is sort of an introduction to fetal gender determination or fetal sexing in cattle. I presume there might be a variety of levels of experience with regard to this topic. So I made sure to tell Nicole to please just type in if you have any questions. I don't mind being interrupted. It is a very interactive type of topic. There will be a lot of images presented for interpretation. So no doubt questions will come up or you might not see what I'm alluding to. So by all means, do stop me if you have any questions. Okay, we're going to jump right on into it here. So, well, get my screen to work. There we go. So first of all, I do want to say a giant thank you ahead of time for to Dr. Sandy Curran for providing the vast majority of the images that I use in these presentations. She takes incredible images and a large volume of them. So we're very lucky to have all the content that she provides for us. These are lovely images. I think you're going to find that it's a whole lot easier to interpret what she sends us than maybe what you're getting in the first place if you don't have a lot of experience, and that's just to be expected. So hopefully you can take some concepts away from this and just spend some time practicing to get honed in on these skills. So briefly, I just want to highlight some of the benefits of fetal gender determination. Why might you want to implement this if you haven't already in your practice? So first of all, there are higher sale prices with known gender. Identification of free martins is a big deal as well. I always like to know when that's coming. Culling decisions, herd management decisions. And then probably just the biggest overall reason is because there is increasing demand and you want to be able to offer this to your clients if they ask for it. So fetal gender determination is traditionally done between about 55 and 80 days. And I would say now that we have better equipment and transducers that are able to penetrate deeper into the uterus, we're able to do these much later than we were in the past. So it's not unusual to do them at 120 days. We're even doing them transabdominally in several species. So that quite lengthens the amount of time that you can that you're able to perform this examination. 55 to 80 days is pretty reliable for being able to reach the fetus in most animals and being able to get the angle on the image on the fetus that you want. So what we're looking for is the genital tubercle, and this is the embryological structure that will become the genitals of the calf as it matures. The GT forms between the hind legs of the fetus, and after about 45 to 50 days of gestation, it begins to migrate. So it's going to migrate cranially, and you'll find it behind the umbilicus in the bull calf, and then caudally, and it will end up under the tail head in a heifer calf. So this is the GT is seen as a hyperechoic structure. Especially early on, it's really nothing more than a bright white structure. You'll see it described as parallel lines or an equal sign, and I hesitate to encourage you to really look for that specifically because The appearance of it can change a little bit depending on your angle, depending on the stage of gestation. The important thing to know is that it is extremely hyperechoic, bone density really, or bone echogenicity. It will become more soft tissue appearing as it matures. So as we go from just a GT in a small fetus or a small embryo to a well-formed anatomy in a later term pregnancy, it's going to look a little bit more like the rest of the soft tissue echogenicity. So at that point, you're just looking for the anatomy in a slightly more mature manner or more mature appearance. After 75 or 80 days, you're going to start to see some secondary organs as well. So you'll see teats forming and you'll see a scrotum and bull calves as well. It's really important to know that ideally you want a negative and a positive identification. So it can be really easy to think that you see a heifer calf and then not go and check for the male GT that could indicate a bull. And the reason that this is a pitfall is because there are things that can complicate your interpretation. So you'll find in some of these images, for example, the vertebrae and the base of the tail can be quite confounding. Those can start to look like a female GT. So rather than just making a quick assessment based on one location, you really want to get a negative and a positive identification on these calves. The best advice I can offer you is to train your eye first. It's really difficult if you've not done this before to try to interpret what you're seeing with your brain and get the image that you want with your hand and try to do everything all at once. So if you have the opportunity to, look at as many images as you can and learn to identify the structures and make a diagnosis before you add in the complicating factor of obtaining the image that you want. And it can take a long time, hundreds of attempts to feel comfortable, but as with most things, practice is what's going to get you there. Okay, so these are the structures that we're looking for. Got these images off the DROS project. On the left there is the female GT right under the tail head, and on the right you'll see the male GT just behind the umbilicus. And there's a scrotum in this calf as well, so we're probably looking at about an 80-day plus calf to have that level of development. On an ultrasound image, here's a heifer calf, so we're looking at the gross anatomy, of course, on the left. On the right, what you're seeing is a dorsal view, and I'll get into those two of this heifer calf. You can see to the left, you can see my pointer here. To the left, you'll be able to see the ribs, a cross section through the ribs. So this is the abdomen back here. This is a hind leg. This is a hind leg. And you'll see two bright white structures next to each other. You can see the female GT, and then this is a cross section through the tail. And this particular view, that's a really good way to identify a female, as being able to see two distinct structures right next to each other. In the bull calf, the GT is going to be right behind, right caudal to the umbilicus. So again, in a coronal or a dorsal view of this fetus, we're looking at the bright white hyperechoic male GT just behind the umbilicus, which is here. So you can see four limbs, cross sections through four limbs here. This is the amnion, and then right behind the umbilicus is the male GT. Very obvious in a still frame that we can point out to you, but when they're moving, it can be a little bit trickier to try to identify. So those are the structures we're looking for. A big key point, learn to recognize the umbilicus and appreciate the umbilicus, where it's coming from, where it's going to, because this is your major landmark, of course. So I always describe the umbilicus as looking like a 5-lane highway. It's got the blacker or hypoechoic vessels running through it, interspersed with layers of tissue. So you'll get this striated appearance to that. Here in the upper right, this is a heifer calf. You can see the female GT up under the tail head, way at the caudal aspect of the fetus. And this is a bit of tail right there. and then the umbilicus coming out of the abdomen. This is a dorsal view of that, so you're not seeing a whole lot of the abdomen. It's a little bit out of sight in a different plane. Over here on the left, it's a little bit of an oblique view, but you're seeing where the umbilicus, which is kind of twisted on itself, is going into the abdomen. And this lower right-hand image is probably the best example. You can see right where it's going into the abdomen. This is right at the point of insertion. You're able to see the vessels and the layers of soft tissue, and it's not twisted, so it's really apparent. So learning to identify that and using that as your major landmark, your male GT is going to be right adjacent to that, and your female GT, of course, would be up under the tail. So these planes, this is something that I know for my way of learning and understanding things, I really like to be able to think about the mechanics. Not everybody learns this way, and certainly you don't have to remember the names of these planes, but I think it's helpful for remembering how ultrasound works and how you're obtaining the image that you want, and ultimately then how to manipulate the probe and move your hand so that you can get the image that you need in order to identify the gender. So remember that the ultrasound beams are coming out of your probe in a thin sheet. So you're only ever seeing one thin slice, one two-dimensional image of a three-dimensional structure at any given time. And that sheet of ultrasound waves is coming out of the probe sort of like a knife would penetrate through a piece of fruit. So I've got these images. If you think of your probe as a knife and you think of your fetus as a piece of fruit, just keep in mind that if you slice it from stem to stern, it's going to look different than if you slice it across the middle. So here we've placed our probe or the knife across the orange through the middle, and you get that pinwheel appearance, versus if you cut it stem to stern, you're getting that that sort of wedge-shaped appearance to it. So same thing with your fetus. You can use these three movements: fanning, sliding, and rotating your probe head in order to obtain the image that you want, but keeping in mind these basic concepts. So on the left there, this would be referred to as a sagittal section, just like in your gross anatomy, pathologies, and things like that. So if your probe is sort of oriented down the long axis of the animal, from from dorsal to ventral, you're getting a sagittal section, which appears like the lower image shows, much like if you were to draw a cow on a piece of paper. That's that side view is what you're looking at. A transverse section, of course, looking like the middle images there, where the probe is oriented across the short axis of the animal. And then the dorsal or coronal view is the last image there on the right. And this seems to be perhaps the most commonly used plane, although transverse images are used a lot as well. And that's going to give you a sort of overhead view of the fetus. So again, it doesn't really matter what they're called, but just keep in mind that you can make this interpretation from any of those views. And just knowing if you're getting something that's a little bit oblique or something that's not quite what you wanted, how you might move that probe to get the fetus oriented the way you want it. So again, sagittal view, frontal, also called coronal or dorsal view, and a transverse or cross-sectional view through these fetuses. You want to try to avoid obliques, and that seems pretty obvious, but the main reason is there are things that can complicate your interpretation. So if you get a piece of femur or something transposed over the area where a GT should be, that's going to be bright white, very hyperechoic, and can complicate the interpretation. So do your best to learn to manipulate the probe and get an image that falls into one of those three views and isn't terribly oblique. Okay, so that is the quick and dirty version of the how-to on that. So we're going to jump right into some image interpretation. This is the important part. So we're going to spend the majority of the rest of the time just going over some images. Please do, again, just comment if you want to make an interpretation. Otherwise, if nobody says anything, I suppose I'll just let these play a couple times through, and then I'll point out the anatomy that we're looking at and how to make the interpretation. One more time here, since it's the first one. Any takers on this?
We had one individual make the comment male.
Okay, fantastic. Thank you whoever you are for chiming in. And you're correct. Yes, this is a bull calf. And I'm going to see if I can't just pause this and show you where we're making that interpretation. So, yeah, so of course we're fanning out of the plane of the abdomen of this animal, this fetus, so the bulk of the body starts to disappear. But right here, right about in this plane, you're seeing the umbilicus here and the male GT right behind it. In a paused view, it's a little bit harder to distinguish the two structures. So to some degree, you might just have to believe me, and I'm going to replay it again so you can see. But there is a distinct structure sitting behind the umbilicus here. This is a cross section of the tail head to the right, or to the tail, I guess I should say, to the right. And you can see the four limbs in cross section and the head here to the left. So these are all of the structures that you want, and that's a very good frontal or dorsal view of the fetus, nice and symmetrical, exactly what you would want to see. So yes, that is a male, that's a bull calf, so good one to start on. Let me let it play a little bit so you can see it again if you didn't see it the first time through. And of course, we're making that negative identification as well behind, so you can see the tail in cross section, but there's no female GT. Okay, next.
We had someone chime in heifer.
Okay, yep, it sure is. So, pause this. And actually right there is probably our best view. So here we have, oops, slippery fingers here. All right, great. So ribs here, so you can see the thoracic cavity up here. The head is off the screen to the left. This is the abdomen. We have actually probably a femur right there, cross section through a femur, two hind legs right there. To the right here is a cross section through the tail in that plane, and then right between the hind legs on the back side, on the most caudal aspect, is the female GT. So good call. Let me replay that one more time. And please, if you're not seeing it, feel free to slow me down, or stop me, and we can go through it a little bit more. I have plenty of images, so we can get some practices. All right, good. So that's a great heifer image. Okay, next, another about 64-day pregnancy here. And this one's in a transverse section, so this will be the first one we're seeing that's in a cross-sectional view. You're seeing basically a round transverse section of the abdomen rather than the entire length of the fetus on one screen. More time here. All right, any takers on this one? Okay, so this is the first one in a cross-sectional view or a transverse view. So go through this a little bit more frame by frame. So we're going to start, the image starts at the tail end of the fetus. So right here we're seeing the two hind legs pointing off to the right. The little cloven hooves are off on the right-hand side. This is the body of the fetus over to the left. As we fan through, actually right there, there's right in the beginning, you're seeing your best view of this female GT. So right here, you've got tail, bright white tail, and bright white female GT. We fan through a couple of levels of that image, so you can see it pop in and out there, but they're quite distinct. And then as we fan forward, just as importantly, we're going more cranial on the calf, eventually. So there's the GT and tail as well. And now we're starting to scan more cranially, and you'll see we're going from the hind legs into the abdomen, and there's the umbilicus, and we did not pass through a male GT, where you would have seen that bright white GT right behind the umbilicus. So we've gone back and forth through that area, fanning back and forth a little bit. You're seeing a great umbilicus as it's kind of diving into the abdomen there, the ventral abdomen, but no male GT. And then up through the thoracic cavity, you can see the heart beating there and the lungs, and up to the head. So what we're really looking for, again, is this right there. So you're able to see a foot, a leg, tail, female GT. Okay. Next. So now we're jumping way ahead. This is 97 days. So again, previously we may not have been able to reach these or maybe not image them as well. Now if you get the right orientation and the abdomen of, I have particularly short arms, so difficult for me to reach these guys sometimes, but if you can reach them and the calf is sitting fairly superficial and in the right orientation, these are definitely possible now. Probes and equipment are doing a much better job than they used to. So very cool image.
We had someone say bull.
Yep, it sure is. So this one's interesting. We're going to go through the whole thing a little bit because we have a lot of anatomy here to look at. So first thing that the operator does here is we're fanning back and forth at the very tail end of this calf. So you can see the tail with the vertebrae, and then we come into the body of the calf, and we're just going to go back and forth a little bit here, and we're not seeing a female GT. There's nothing at this stage. It's much further along. It would be a little more soft tissue echogenicity, but there's no distinct structure there other than the tail. Then as we start sliding forward, right about here, you'd potentially be seeing an udder with some teats in a heifer calf, and we're not seeing anything like that fill up that space between the legs. But we get a little bit further cranial, and we see a scrotum. So that's our first hint here that we've got a bull. And then as we continue to move even more cranial, here we're going to have a male GT right there, which is actually just a relatively well-developed penis at this point. And then just cranial to it, there's the umbilicus. So the difficult thing about a cross-sectional or transverse view is that you're not going to see these two things at the same time. So you have to have some skill, a little bit of dynamic exam occurring in order to identify one and then identify the next. You're not going to see them side by side like you do in a frontal or a sagittal section. So male GT, umbilicus, and scrotum, and lack of a female GT. All right, good. You guys are on it. No wrong answers yet. Okay, so 68 days, back to a little bit of a more traditional timeline. Okay, any takers on this one?
Fur?
This one is very wiggly. And this is maybe a little more real life. So we're moving quick. At times, parts of the fetus are off the screen, so it makes it a little bit tougher to determine, to see everything kind of all at once. This one's actually a bull, and we'll come back and scroll through it here. So again, another dorsal view, and this guy's kind of kinked and sideways, which is fun. So here we're coming through a plane where we have front leg, hind leg, and so we're looking right in this area. That's umbilicus right in the middle. Nice big meaty structure with vessels running through it. And right there is your male GT right behind it. Now again, we're wanting to double check that. So as we go back here towards the caudal aspect of the calf, you're seeing amnion coming, is this thin structure sweeping around the calf, and this is tail, which is, dynamically it's a little easier to identify, I think. But if you look right in this region between those two hind legs, you're not going to see female GT. So let's just, so like right here we've got tail and the two hind legs coming together here. And there's no female GT. This one is a little bit, like I said, faster, a little harder to nail down, but right there, you're definitely seeing that umbilicus next to the male GT. Everybody see that? Any concerns about that?
Thank you for pointing it out. So
Sure, no problem. This is a little bit, like I said, a little tough to not be interactive with. So now, are these recordings available to them after the?
yes. So I am recording the session and we post them afterwards to our YouTube channel. It usually takes me a day or so to get them up.
Wonderful. Yeah, so you can go back and look at these if you have any questions, and maybe Nicole can make it my email address available to you as well if you have any questions.
I sure can.
Okay, so this one's 74 days. I feel like I get less, or I get fewer guesses on these transverse section ones. I don't think you like them as much.
I think we had a couple people say bull.
Yep, great. So that is definitely a bull. Let's go back here. So starting out at the head, and then quickly moving back to the back end of the calf. So the first thing we see is umbilicus right here, and then moving back caudally. Right behind it is your male GT, which is pretty bright white. Now there you're looking at kind of something that's more like those 3 parallel lines that people talk about, but you'll see it's not like that in every frame. So getting really hung up on that could do you in. So I would just, be looking for the right location, the hyperechoic nature of it, especially earlier in gestation. And then coming more caudal from that, we're going to see a scrotum that's a little bit less developed. That's still male GT, umbilicus. So she's fanning back and forth a little bit as I progress through this. But as we come back, here we go. So here are the 2 hind legs. And in between, we're seeing a little bit less well-developed scrotum than the ones that we've seen before. This one's a little bit earlier. So there's just a little bit of a bulge there where that will become a scrotum. Then we're coming back to the back, comes back to the tail. But as we fan back and forth at the caudal aspect of the calf, there's no female GT. Lots of hyperechoic structures in the pelvis. So those certainly can be a little bit confounding as well. Again, this is a reason to thoroughly investigate both locations. And at this stage, at 75 days, you would be expecting to see something more distinct, a more distinct anatomy, a fuller looking structure. Really good. Okay. Next. 84 days, another transverse view. Let's do one more time here. A large fetus.
A couple of people have responded with heifer.
Yep, great job. Okay, so we'll go back here. So we're gonna start actually right off the bat. You're getting a pretty good view here. So we have kind of the buttocks of the fetus here, and as we move just a little caudal, right here is your female GT and tail. She'll just fan in and out of that a couple times, so you can see that on multiple occasions coming in and out of view there. And then as we move forward, here we have the development of a little bit of an udder. Hind leg. And coming cranial right into umbilicus with no male GT in between. Another thing to note here is that when you're in the thoracic cavity, of course, you have sort of that more narrow oblong shape to the transverse view. So that's a good, another good marker for moving your probe. As you come back into the abdomen, it gets much rounder, and then right in that area is where you'll see the umbilicus come in. And caudal to that, we don't see anything. Udder development, and then female GT and tail. Good. All right, you guys are good at this. Here's a 54-day, so going much earlier. This is really, really the early end of when you can interpret these. Lots of practice. Dr. Curran, of course, is very, very, very experienced. Caution you again, remembering that the GT initially forms between the hind legs and then migrates. So no matter your skill level, don't think that you're going to be able to do these at 45 days because it's really just indeterminate at that point. I think you'll feel most comfortable waiting to 55 or 60 days, especially in the beginning. A little bit later. This one's a little squirmy as well, but it's a great view.
We have a couple responses of heifer.
Yep. So this one's definitely squirmy, but let's just scroll through here and we'll see great frontal view here. We've got 4 limbs, a head, tail sticking out the back there. Let's see if I can sharpen that up. Yeah, so tail is going to be here, and this is your female GT, kind of behind the plane of the 2 hind legs. So there's umbilicus right in the middle. You can see the little feet, a little cloven hoof there, and right there is probably our best shot. So we've got tail, female GT, 2 hind legs, and umbilicus right in the middle. Good job. Okay. 59 days. As I watch this one, I think it might be a little bit tough if you're new to this, just because it's so squirmy. Not quite sure what plane you're looking at different places. Any input?
I have a couple that say a heifer and a couple that say both. So
Yeah, so that confirms that. I think this one's a little bit tougher, but this is a bull. So right there we're seeing umbilicus. And right there is the male GT. Now, that looks like it's basically dead between the hind legs, so that could make it a little bit tough. And I think what's happening here is that even though this is a frontal or coronal view of this fetus, the hind end tends to, well, both ends tend to curl a little bit at times, and this one's squirming as well. So you can find yourself wondering if that's actually the most caudal aspect of the fetus or not. But as we let it play a little bit, you can tell that that GT is right next to the umbilicus. Get it to come in again, right there. You can see umbilicus there and male GT's immediately behind it. And then as we fan through the fetus again, you'll see that the tail and the most caudal aspect of the body is significantly further caudal than that. Let's see. So here, I mean, you can kind of see the most caudal aspect of this hind leg and this hind leg, and the tail's right here. So you sort of faintly determine that this is kind of the most caudal aspect of the fetus. And we're seeing that GT right next to the umbilicus. So this one is a little tough. It is, I guess, ultimately slightly obliqued because of the movement and whatnot. But right here is our most important view. They're really adjacent, and you're not going to see that with a female GT. So tough one. Okay, this one is a 97 day, so now we're getting even later. All right. Yeses.
I have a couple that have responded heifer.
Yep, sure is. Good job. Okay, so I'm gonna go straight from the skull here at the cranial aspect, backward through the chest, heart and ribs, abdomen, fetal stomachs, liver. All right, so here's our umbilicus. Really nice view of the umbilicus, fanning through that. We're not seeing anything. Get a little bit of disruption there where we're not really seeing the sort of the udder area. Well, I guess there you can see it a little bit. Two hind legs coming into view, and that's a perfect view right there. Tail head here to the left, and female GT just adjacent to it, two hind legs. So we're getting a good negative and a positive on this one. Well developed, really nice view. All right, good job. Here's an 80 day and another one in transverse section. One more time here. Okay. Any takers?
I have a couple that have guessed heifer.
Yep, good job. Okay, so kind of similar view, stage, and of course the gender is the same as the last one. But since it's a different clip, so this one's a little more laying on its back, legs up in the air. We've got the umbilicus twisting on itself and going into the abdomen there. Coming back, there's your female GT right here, and your tail coming out as well. And I think we fanned through that a couple times, so you've got a good view. Right there again, a good longitudinal section of that tail and the female GT there. We've also are able to see, so we're starting to come into a little bit of a more frontal view. We've kind of transitioned from transverse to frontal, and you're seeing the umbilicus go in there, but you're still able to see that distinct female GT next to the tail. All right, cool. So this next one is a little bit tougher. I put it in here to really test you. It's not a trick question or anything. I shouldn't have led you that way, but it's quick. All right, anybody want to venture a guess?
I have a couple that are saying heifer and a couple that are saying bull.
Yeah, that's what I anticipated. So the reason that I say that this one is a little more difficult is simply because it moves quickly and the angle starts to change just a little bit here towards the end. And right about here, the cross section of the tail can really throw you. So this looks, you definitely could be thinking that's a female GT. But importantly, as we scroll forward, there's umbilicus here to the left, and then right behind it, that's male GT. It comes and goes very quickly. And then we have scrotum as well right there. But right in this view, you have scrotum here and what, could look like a female GT at that point. So the tail is probably one of the most complicating factors. Very easy to, especially when things are moving fast, and you're being flung around, it can be really difficult to determine whether that's tail or female GT. So I love to get at least a couple frames where they're distinctly side by side, and you're not just trying to decide whether that one structure is a GT or a tail. So we'll let this play one more time, but just focus on that male GT and the scrotum being visible. So this is one where I take that extra minute to really try to get that negative and positive identification on both ends. And of course, this moves quickly because Dr. Curran is skilled, but if you needed to spend some extra time to get a slightly different view, make sure you're not obliqued, that's obviously what you want to do. I think the most important thing when implementing this is not to ever just guess. If you need to recheck, if you need to come back and recheck in a couple days, certainly do that before you just throw something out there. All right, good. So next one, 55 days. Early end. Takers?
Don't have any this time.
Okay. Everyone's getting tired. Okay, so this one is a bull. Again, it's earlier. The nice thing about the early ones is that GT is nice and hyperechoic. So if you can get it to stop wiggling long enough to get a decent view. So right here, you've got 4 limbs, a head, and the umbilicus. And then a couple frames after that, you'll see the male GT come in here. So again, it's a little bit closer to looking like it's between the hind legs. It is adjacent to the umbilicus, so we're comfortable with that. And the main reason we're comfortable with that is because as we do get a better view at the back end of the calf, right there, it's not up next to the tail head. I know it's a little off the screen. Let's see if we can get it there. So there you've got tail. That's a good view. So there you've got tail, no female GT, and right there you have your great male GT right next to the umbilicus. This one again is also moving in and out of that great frontal plane as well. So as the hind end swings around a little bit, you get a little bit of a slightly more transverse section, can make it look like that GT is between the hind legs. So evaluating these in real time, much better than trying to look at a still frame. Obviously, I'm slowing it down because it's easier to interpret in the beginning when you're new to it, if you can, look at some isolated frames, but in real time, you're gonna, like here, right about here. So you're seeing the male GT sitting not at the caudal aspect of the fetus. And they don't always cooperate, so this is pretty typical of what you might see. Okay, so here's a fun one. Got some twins here. So in a real life situation, you're wanting to rule out a free Martin situation. So this is something you might see routinely. It's quick, it's a little jumpy. Anybody worried about this set of twins? Anyone concerned we might have a free Martin?
A couple people saying concern and some people saying no.
Okay. Yeah, this one, this one I feel is a little tough. It's quick and the fetuses look a little bit smaller. They're moving around a little bit. These are both heifers. So let's see if we can identify them. So here's fetus number 1. Now this is a particularly difficult situation because you might not, it's a little hard to get them both in a perfect plane without a significant amount of movement when you're trying to assess one and then assess the other. So here's fetus number 1. You can see tails here. Female GT is there. At this point, there's a little more space between these than we've seen on some of the other ones, but you have to remember that depending on the plane that you're in, this tail is moved away from the fetus a little bit. So they're not always going to be adjacent. What's important is that it is at the very most caudal aspect of the fetus. The limbs here you can see are cranial to that. And as we move through looking for the umbilicus, the male GT would be up here adjacent to it. So there you can see it again. Let's see if I can get it better. Right there you can see it again. Right there, that's a nice one. And then we're moving over to the other one. This starts out in a more cross-sectional view. There's umbilicus, hind legs, and we're not seeing a male GT. I think she goes through that a couple times. Yep. And then there's a hind leg, hind leg. This one was a little bit tougher to see, but right about here, you can see the beginning of a female GT. Let's do a couple more times. Right. Tail. This one's hard to pin down. Very difficult to get a frame of the female GT in this cross-sectional view. I guess equally important is just the lack of the male GT. So definitely no male GT caudal to that umbilicus. And I think in real time, you can, right there, you're seeing female GT and sort of a cross or a longitudinal section of the tail. You can tell largely by the size of this structure here that it's not all tail. But I'm going to let it play in real time again because it's a little easier to interpret, I think, in real time. So this is still that first fetus, and then the second one, definitely harder to interpret. So as a newer practitioner to gender determination, I would probably try to change my angle 90 degrees on that second fetus and get a different view on it to confirm. But the lack of the male GT is your probably your first sign, biggest sign. Okay. I have one more. I thought that twin one would be a little frustrating, so here's a more typical one. So this one's 106 days. Just kind of shows you how much more we're able to do now, significantly further along, much better developed. Biggest challenge is fitting the anatomy that you need on the screen, getting the penetration you need if the fetus isn't sitting right, superficial. Just gonna leave it there for a second.
I have a couple of responses of heifer.
Yeah, good. So this image, it's fun to look at. It's a really neat image, but we do spend a fair bit of time not at the areas of interest, kind of looking at some abdominal organs and the heart and whatnot. But as we get back here to the tail end again, tail, hind legs are coming out to the right, pointing down to the right and right. Ooh, there we go. Beautiful. Tail, female GT. There's a limb and there's a limb. So, yep, that's a great cross-sectional or transverse view there. I have, apparently didn't save my my thank you screen, but I have a ton more images. This actually jumps right into some older images, and I know some people like to look at older images without the resolution of kind of the latest and greatest. So you can see that these images we've been looking at today are as nice as they come, and not everybody has the luxury of looking at images like that. So if it's helpful to look at things that are older, maybe not as crisp, I have tons of those as well. So feel free to reach out to me if you have questions or you want to look at different types of images. I've got a huge library of them, but I do find it a little bit easier to teach on the really nice ones so you know what you're looking for. Any questions?
So if you do have a question, please type it in the Q&A area. But in the meantime, I know we had a couple people that joined us a little late. And so could you just reiterate which is the best plane to image in for sexing?
Yeah, so let me just scroll back in our presentation here. So we've got the three, so these are our three planes, and fetal gender determination could be done in any of these three planes. Honestly, in a perfect world, I would love to see images in that sagittal plane, the one you see all the way to the left, because theoretically you could see all three areas of interest in one plane. So you'd see the umbilicus come out, you would see whether there was a male GT, and you would see whether there was a female GT, because we're looking right on midline. It rarely works out that way. You can see we had very little, maybe no images today from that particular plane. My preference next would be to do them in the dorsal or coronal view, because same thing, you're at least getting the whole body on the screen at once. And even though you have to fan back and forth a little bit because the female GT is going to be more dorsal than the male GT is, at least you're able to see something for reference. With the cross-sectional view, I think the heifers are tough because the tail can get in the way, and and you need a much more dynamic exam, because you're not going to, once you see the umbilicus, you're not going to see anything else. So you need to make an interpretation based on basically how much you're moving the probe between the umbilicus and where you would expect to see a male GT. So there's a little bit more interpretation required there. But like I said, any of the three views can be used. You really just need to get comfortable with them.
And a reminder also for those who might have jumped on late, what is the accuracy of fetal sexing by ultrasound?
Yeah, so I think Dr. Colleton, one of her chapters in a textbook did reference that the accuracy of fetal sexing can approach 100%. Of course, it's one of those things where skill is the main factor. So in the hands of a skilled practitioner, it can definitely approach 100%. Practice is obviously so important. It's not a simple skill. It's not the sort of thing that can
I don't have any other questions at this time.
Great.
Evaluation later on. So if you could please answer that, particularly we'd like to try and bring a few more of these lunch and learns to our large animal audience. So I would greatly appreciate your input on that. And then I'll also be sending you your CE certificate. So if there's no other questions, I'd like to greatly thank Dr. Wireman for her time and all of the wonderful images that she brought to us today.
Thanks, guys.
Thank you. Have a great day, everyone.